Hey, thanks for stopping by Minnesota Black Robe Regiment. As always, if you're on YouTube, make sure you're subscribed because, I'm chasing numbers now. Like, comment, and share. Make sure you're getting notifications by clicking on the bell icon down there. That way, whenever I have something that comes out, you can uh, be glued to it because I need you to watch as much as possible. Because, as I told everybody, I finally got monetized. And boy, at this rate, I'll be able to retire sometime when I'm 2,048 years old at the way YouTube pays out. So, no, thanks for all of the subscribers and followers, especially over the last month and a half. It has been mind blowing to even get to this point. When I launched the channel, I never thought it would happen, but I also never thought I'd lose a career for standing up for the Constitution, and I never thought I would ever find myself on the opposite end of the spectrum of the medical field, especially living in working in the area around the Mother Mayo. I always got along really well with the medical world, and I never thought I'd see them protest against medical freedom. So, as most of you know, as the COOF, and for those of you that don't know, we don't say COVID on this channel. We say COOF because if we use the other word, which I just used, YouTube likes to use that and justify either pulling your stuff down or demonetizing it. So we're going to hope that they didn't catch that one. So I'm through all of this, I have been blessed to meet a lot of people, and some of them just mom and pop business owners. Others have been just people on the street whose loved ones have been locked away in nursing homes and long-term care facilities, and they're not allowed to see them. You go back almost 2 years now. Had a conversation with a lady on my very first day doing man on the street stuff that her parents were separated in a long-term care facility, and she wasn't able to see them. I've met others who have traveled from one end of the spectrum to another, and just yesterday I had that opportunity to meet someone in a Telegram group where we are discussing what it's going to look like to launch a clinic in this area in southern Minnesota that's going to practice what it preaches, which is medical freedom, medical transparency. And lo and behold, we've been talking so much about finding, if we can't find, doctors, and quite frankly, it's the nurses and the CNAs that do all the work, which has been eye-opening for a lot of people, especially. But the other area of nursing that has really demonstrated that doctors, for the most part, just make a lot of money while everybody else does everything for them, have been the nurse practitioners. And one of the people that I met in this group yesterday is Laura, and I'm going to bring her on here in just a second. Laura is a nurse practitioner, and she has a story to tell you because she's not your quintessential whacked out right-wing weirdo that everybody thinks I am. Which, of course, if I'm a whacked out right-wing weirdo, you would not want to know a lot of the people I've met in my life. But I'm going to bring Laura on. I'm going to let her introduce herself, and I'm going to let her tell us about her journey, because if it's not eye-opening for you, it will be for somebody you know. So, Laura, thanks for joining me today, and sorry for the really long intro there.
Oh, no worries at all.
Normally I pitch my Minnesota Black Robe Regiment coffee, but I figured I'd better get to it by now. So you're coming to us from Montana.
Correct. Yes, I'm just right outside of Helena.
Can't go to hell in a handbasket.
Right. No, it's beautiful here.
Yeah, it's probably one of the most beautiful cities in the state. I mean, it's definitely better than Billings.
Correct. I would agree with that. Correct.
Definitely better than Butte, which is the largest man-made hole in the ground, and I'm not even talking about the mines around there.
Right. Yeah. Butte is interesting. Lots of history and character, though.
Yes, absolutely. I'm allowed to make those jokes because I used to live in Montana. So, and if you're not from Montana, you can't make those jokes.
No, correct.
Cannot make those jokes. Yep. So, Laura, we were chatting a little bit yesterday, and well, mostly I was watching you chat with other people because you somehow became aware of our group and got added in, and you were encouraging us But part of your story is a reflection of what I saw when I was started to go to protests, freedom protests, and medical rallies, medical freedom rallies and protests back in 2020, starting in March and April. You would have maybe been one of those medical practitioners, especially as a nurse practitioner. You might have been one of those doctor nurse types that would have been out counter protesting all those radical crazies who wanted to kill grandma with the coof. Remember, we say the coof.
Okay.
Don't worry about it. But so you might have been one of those that went out there all in scrubs and a mask on and held your signs telling us to stay home and stay 6 feet apart. If I understood you correctly.
Yes, that's absolutely correct. So I have many years of education. I started as a dental hygienist, so I had 3 years of education, college education there, and then I went to be a registered nurse, and then did a master's, and then did a doctorate. And I, 3 years ago, 4 years ago, I would have told you you were crazy if you didn't get a vaccine. And my husband can attest to this. Every year I would say, you have to get your flu vaccine. You're being silly because you won't get vaccinated. And he just looked at me and he's like, I'm not putting poison into my body. And of course I would roll my eyes as a nurse practitioner and tell him he was crazy. And so I was drinking the Kool-Aid, and it wasn't until the coof came around.
I got another one.
Yes, it wasn't until that really came around that nothing made sense. I mean, I was taught if the CDC says something or the World Health Organization writes or says something, that's like gospel, and you can use that in papers. And I mean, that's what our practice is guided by, NIH recommendations. And so when the coof hit, it was like critical thinking went out the window. And a little story. So I was hearing some things about wearing masks, and are masks going to be effective against preventing this illness? And when this was like in probably March of 2020, I did just a basic literature review, and I looked up articles to see if masks were effective against viruses. And I found article after article that they were not effective at all against viruses.
And this would have been in early 2020.
March of 2020. By summer of 2020, when I would go online to try to fight somebody on Facebook who thought that masks were going to save the world, I would go back to try to find those articles, and they had all been removed.
Yeah, they got memory hold, literally.
Yeah. So that was one of the first times that I started to really question, like, what is going on?
And then, you weren't arguing against masks because you've always been against them. You were arguing the practical side as a practicing nurse practitioner with a doctorate. Mm-hmm. And it's not from like Haiti or anything.
No, it's from Bismarck, North Dakota, a private Catholic.
Well, Haiti, Bismarck. I mean, no, I'm kidding.
True.
No, I'm kidding. I love my North Dakota neighbors. So this isn't, this isn't like you were like, this is all a scam and everything. You were just saying, look, right now the facial coverings, like, the evidence is out there, the research is out there, the reports and the studies are out there, the peer-reviewed papers are out there, that this isn't what is going to prevent this. You're reading all of this. Never thought that you would need to save those or print them out or anything. And then you go back to find them, and voila,
they're gone.
They're gone.
Yep, they're gone.
But you're still kind of like, this is a serious thing, and we need to take action.
Yeah, I mean, I was a school nurse when H1N1 hit. And so we had a lot of kids that were out due to being sick, and even some staff members who ended up in the hospital. And the reaction from H1N1 that affected young people more than it did elderly, the mandates and the talk of shutting everything down, that never was a question back in 2008, 2009, whenever that hit. But all of a sudden we have a virus that, from what we knew early on, it affected elderly people more often and people with comorbidities, which is what happens when you have a novel virus that just comes out. It's going to get the people that are extremely young sometimes or extremely old. And then it, as it, I guess, evolves, it becomes less deadly and we just learn to live with it. And so it was just interesting, the way that this was approached from very early on about, there was talks about shutting down very early on. And so that was just odd to me because I was literally in a school district with lots of kids out during H1N1 and we never shut down. I mean, there was never even a talk about shutting down.
And you didn't quarantine the kids?
Did not quarantine the kids. We did not wear masks. So it just wasn't making sense. And my whole educational background was you don't follow the status quo. I was taught to use critical thinking skills. And if something didn't seem right to me, I didn't just do it because that's the way it's always been done. I was encouraged to go research it. And so that's what I did. That's just the basis of who I am. And so when I started to research it and then that research disappeared, my little antennas were just going, oh my goodness, what is going on? And then, I'll be honest, I went down some really deep rabbit holes and came across a lot of different groups. And I mean, some were, way too far out there. I don't think the world is flat, but
no, you cannot say, I don't think the world is flat, but, because that's going to make people think you're going to say the world is flat. So we're going to.
True.
Your Honor, I'd like to have that stricken from the record, please.
I
don't think the world is flat.
Okay. I don't think the world is flat.
Okay. I was like, we're going to have to kick her out of this conversation.
No, but I did come across a lot of different things that really made me realize that my whole adult life, and especially my whole educational life, with all of my years of college, I was like lied to. It got me questioning everything. And if the CDC and the NIH can be so, so full of deception, it makes me question everything. And so I'm to the point where I have moved away from thinking that our country has one of the best medical systems in the world because we do not provide health care. We provide sick care. Yeah. I was never taught, we learned basic, you need to exercise and eat right and things like that. But my whole education was taking a symptom and then telling a person what drug they needed to take to fix that. And
more often than not, the drug that you were giving wasn't really to do anything for the thing that was causing the symptom. It was to alleviate the symptom until what was causing the symptom went away.
Correct.
If I understand that correctly.
Yep. Correct. Yeah.
Let me ask this and don't forget where you were about sick care versus actual well care or health care. Mm-hmm. Would you have considered yourself apolitical, more left-leaning, more centrist, more right-leaning before all of this, or?
So I grew up in a Republican household. We didn't have much money. My parents always voted Republican, and so when I became
Republicans are all rich, wealthy, greedy people, so you couldn't have possibly.
That was my experience. And most of my extended family, that's how we labeled ourselves, Republican. We were gun owning, liked our freedom, liked our independence. And so when I became an adult, I voted along those lines, but I didn't care about politics because it just felt like if I voted for a Republican, it didn't matter because whoever was in the White House did nothing that they said that they were going to do. And so I acknowledged that and noticed that from a very young age. But I didn't really care. It was just like, I'm trying to do this to better myself, and politics I could have cared less about. And I will be honest,
you weren't politically active. You weren't out there campaigning for certain things. And
no,
you're kind of and I don't mean this in a condescending way. It's kind of a standard run of the mill American Oh, selection time. Better go vote for somebody. Well, what party have I always voted for?
Right. Right. Yeah.
Okay. So,
Correct.
and I asked that question because that kind of stuff is really important, because what you were saying, that actually ties into what you were saying about being taught mostly sick care.
Mhm.
You just kind of go with whatever you've been doing for however long you've been doing it until something like this comes along. And this is where you really started to have your eyes open, both politically,
Mhm.
socio-culturally, and
Mhm.
socio-politically, as well as socio-medically.
Mhm. Correct.
And prior to this, you would have been all on board with the idea. You wouldn't have called it sick care. You
Mhm.
thought you were doing health care and wellness.
I did. I did. Yeah. And it really was, it, when I guess when I finally had my eyes opened, I went through a couple of weeks where I was just devastated. It got me thinking back to when I was in, North Dakota as a nurse practitioner caring for people. Did I, not purposely, but did I hurt somebody by what I was doing? I mean, I always felt like I was giving really good care, and I always prided myself on that. But, looking back now, it's just like, I pushed the HPV vaccine. I encouraged people to get that. And now I've done so much research on the HPV vaccine for cervical cancer and other cancers that can occur in men. And now I'm just like, oh my goodness, did I hurt somebody by encouraging a mother to give their child the HPV vaccine? And so it's made me kind of go back and really investigate everything. Everything that I was taught, I had to reteach myself in the right way, the way that I should have been taught from the beginning.
And that's where you fell off the deep end, and now you've been institutionalized, and you you just you're crazy. You're just nuts.
Exactly.
So how did you go about talking about this? Because you're literally working in a field that's hostile to any kind of change. It's just, frankly, it is. It's just, if you start to talk outside of the prescribed box, you're quickly marginalized.
Correct. So I was employed at a children's hospital, but I was separate from what the main hospital did. It was a psychiatric hospital, and I worked in genetics. And so I was very removed from the COOF. We didn't care for people on the front lines. And starting in March of 2020, we actually worked from home and we did all telemedicine. And then starting in March of 2021, we started going back to doing some in-person appointments, but the majority of what I did, I was at home for. But I worked with a group of people, very intelligent. I mean, some of the best in their field, and which really blows my mind, but they were 100% on board with everything they were hearing and seeing. And so I never felt like I could go to work and tell people my thoughts, because I knew it would cause problems within. We were a small department, and so I didn't want to make a working condition difficult, because I have to work really closely with all of these people. So I would go to meetings and I would have my directors talking about, just how terrible this is and how dangerous it was. And I'll be honest, I mean, when this first came out, I am healthy. I work out at least 2 hours every day. I eat really, really healthy. And so I really thought that if I got this, I'm going to have no problems kicking it. And that's not what happened. But anyways, to go back to my colleagues, I just kept my mouth shut. But my director and everybody that I worked with, especially after the vaccines came out, started talking about how they felt everybody should be forced vaccinated. Can I say vaccinated? Is that going to be
Well, we prefer jab.
Okay, and I agree. So,
Well, I don't prefer the jab. I would prefer that we refer to it as the jab.
agreed. So I would go to meetings, and I would have all of my colleagues talk about how people should not have a choice, and I knew
That
that.
has to be terrifying to
Oh,
hear
it was.
people.
Yeah, it
What
was.
were they even talking about how you would enforce that?
So my director, the one comment that he made that really made me, I told my husband, I said, I'm going to lose my job. It's just a matter of time. But at one of our meetings, which so inappropriate because everybody knew I was the only one that was unjabbed. Like I said, we were a small department, and everybody, once they got the jab, they would, send in, oh, I'm going to get my jab today. And some of them had to miss a couple of days of work because they got sick afterwards. So we knew who was jabbed and who wasn't. So they knew I was not jabbed, but one of his thoughts was that exactly what is happening now, that CMS needed to mandate it. They needed to put pressure on the hospital and clinics to say, if your staff do not get vaccinated, then we'll quit giving you money. And he said, when that happens, people will be forced to get jabbed.
Just for people who aren't aware, what is CMS?
So that is Medicare and Medicaid. So if you're a facility or a hospital that accepts Medicare and Medicaid, you're getting government funds. And for a lot of hospitals, including the one that I worked at, if those funds were taken away, they could not stay in business.
You heard it here, folks. It has nothing. Never mind. I'll let Laura finish your story. So your director is like, yeah, well, we're going to lose our funding, so we're going to be forcing this on you. Mm-hmm. And
yeah,
but you said that you had coworkers mm-hmm. that were all for it being mandated across the board in society.
Yes.
Like forced. That's the only way to go around and get about it. Like at some way, shape, or form, you're coming down to force.
Right. And it was this one meeting, and then thankfully I started doing more of the meetings from home, and then I couldn't hear a lot of what people were saying because it was very uncomfortable. But during that one meeting where my director had mentioned the force jabs, one of my other colleagues said, well, that's probably not going to happen anytime soon because our governor has made, a law against forced jabs. And that was true. And it wasn't the governor, it was actually passed through the House and the Senate. But it's
because even the Democrats in Montana are more conservative than most Republicans in Minnesota.
Right. So yes,
because their constituents all carry guns.
Exactly.
And when I say guns, I mean they all carry numerous guns.
Yes. Yes. So we had a bill, HB 702, and so she had mentioned this bill, saying that it's probably not going to happen in Montana. And I read the bill, but it was not very clear cut in terms of healthcare facilities. It was very clear for nursing homes. Nursing homes had to have their staff be jabbed because that was a federal thing that happened at the beginning of the jab rollout. But in terms of like my previous hospital, it was very unclear whether or not they could, number one, discriminate, and number two, force it. And so I continued to work. They let me come in to see patients, no problem. I ended up getting the COOF in May of 2021. And I wasn't going to get tested because it really didn't matter. If I had it or didn't have it, the treatment was going to be nothing locally. And the only way I was going to get treatment is if I would have went online to find a provider that would treat me. But from the recommendation of my director, he said, you should get tested because if you're positive, eventually we're going to mandate the jabs. So if you can show that you've had it, we'll back off a little bit. And so I went and got tested. I never wanted to get tested, but I did just because I had to work. I needed to keep my job. And it came back positive. And I was the sickest I have ever been in my entire life. So my thoughts of, oh, I'm healthy, I have no comorbidities, I've never been overweight, I'll be able to kick this with no problem. No, I was super sick, oxygen levels in low to mid 80s. My primary refused to do anything for me. Basically, don't come in, don't call unless you need oxygen or hospitalization, and then we'll take care of you. And thankfully,
I want to focus on something here for just a second. I have said on my channel numerous times, and you're hearing it from Laura here, friends and fans and whatnot. Not once have I ever said this isn't real. Not once have I ever said it isn't serious, because I had it last August and I was sick. I don't know what my oxygen levels were because I don't have a pulse ox at home. I felt like I was trying to breathe through a straw underwater, clogged with cotton and mud at times. But I was sick, but I got through it. And the answer was the same thing. Don't come in. We're not going to treat you.
Mhm.
The reason I bring this up is, one, it's the credibility of the issue. Is no one's saying, well, I can't say no one. There are people out there who still claim that it's all made up and no one's ever actually had it.
Mhm.
But I believe the coof is real. I believe that. Laura knows it. She believes it. She's had it just as I have. However, if this is really as dangerous as everybody says it is, when you call and say, hey, I've got it, and you're getting told, don't bother coming in, we're not going to treat you. If it's that deadly, shouldn't the concern be get your butt in here ASAP so we can treat you? And then the reasonable person goes, no, I don't want to get treated because your idea of treatment is prophylactic intubation.
Right. Right.
So anyway, isn't that a little counterintuitive to hear how dangerous and deadly this is? And if you don't want to get it, but then when you do get it, they tell you don't come in.
Mm-hmm. Mm-hmm.
What did that at any point while you were sick? If you're like me, you get that fever thinking going on, and it becomes very conspiratorial. But did you ask yourself during that, like, if this is really that serious, why are they telling me they're not going to treat me?
Oh, yeah. And I mean, just normal, take vitamin C, vitamin D, zinc. They told me nothing. They told me there was nothing that could be done in this early period. And I had already been taking vitamin C and D and all of the vitamins. But yeah, I mean, it gets you thinking. If somebody came in with chest pain or having an active heart attack, you don't say, well, go home and until you fall on the floor and turn blue, don't come back. I mean, it just makes absolutely no sense. And I had, I guess, awakened enough that I knew that there were people doing telemedicine to help people get life-saving medications. And so on day one of symptoms, I had made that appointment for myself. My husband actually brought the coof home to me, and he had very mild symptoms, and he's not as healthy as me. So I really just wanted to strangle him because I was so sick and he got me sick. But I had made it.
She means that metaphorically. She didn't actually want to strangle him.
No, not really. So then on day one, I made the appointment with the frontline doctors, and they say if you have active symptoms, you'll get a call within 24 hours, and hopefully an appointment will follow soon after. It took longer. It was almost 72 hours before I got the phone call.
Well, it's because they were getting their butts handed to them by all the sick people who were actually getting treatment from them as opposed to their local primary care.
Oh, I know. And I don't hold anything against them. It just was unfortunate for me that it was on day 3 and that I didn't know about this to have medications on hand. But got the appointment on probably day 3, and it was just a phone call, which was fine. I mean, I guess I was expecting a little bit more, what are your symptoms type of deal? How are you doing? But it really was a 3-minute phone call that pretty much said, do you want this medication or this medication? And a pharmacy will be calling you to get the prescription sent. So then I had to wait another 2 days before the pharmacy called. And so I didn't get my medications until day 7. And I was bad. I mean, just walking from the basement to our main floor, my chest hurt. I could hardly breathe. It was not good. But I will say 24 hours after taking the medications, my oxygen levels started to come up. And within 2 days, they were well above 90. And I felt like a whole nother person. It would take me several months before I could say I was back to normal. But
nobody's going to believe you're back to normal anymore.
Nobody's going to know. Back to my normal.
You lost normal when you said frontline doctors.
Exactly. So I have a lot of respect, and I owe them my life, because I'm sure I would have ended up in the hospital, and then who knows, it would have been up to God whether or not I lived through that or not. But it really opened my eyes at that point. And I started to think, what am I doing? I'm going to work and I'm working with a bunch of people and listening to people who are just drinking the Kool-Aid, and I can't drink the Kool-Aid anymore. I mean, once you're awake, you really cannot go back to drinking the Kool-Aid. And so I had a hard time. I mean, they're individualized, or as individuals, they're very nice people, but their lack of critical thinking was just really getting to me. And so I started to think, I could be helping people right now. I have the license to help people. Why am I not doing that? And I even, like, back in 2021, if you tested positive, you had the public health nurse call you and you had to stay at home for 10 days. And at the end of that 10 days, she called me and she's like, how are you doing? And I told her, and she was like, I thought for sure you were going to end up in the hospital. She said, what did you do? And I told her that I had taken medications. And she was like, that saved your life, because she had been seeing healthy people like me were ending up in the hospital and some were being intubated. And so she really thought that I was going to be one of those people, and I wasn't. And so I owe that.
There's a couple of guys here in Minnesota that were respiratory therapists who walked out on their jobs, just walked out, because they were telling their facilities, do not use intubation as a prophylactic procedure for this. You're killing people. Their lungs can't handle this. If they don't need, they literally don't need to be they don't need to be intubated. You can put a cannula on them and they can get oxygen that way. But the protocol very quickly became forced intubation.
Right.
And there is Scuttle out there, and you might be able to answer this as a professional, literally with a doctorate. There's some Scuttle out there that actually was more responsible for more of the deaths than the actual contagion was.
Mm-hmm. And I started to hear that early on, that the ventilator was a death sentence. And that was like the worst thing that you could do for the lungs. That should have been a last resort. And it started to be like you said, one of the first things that they did when you went into the hospital. Not to mention, and I won't name drug names so it doesn't trigger this video, but
the algorithms.
Right. There's a big drug that's being used in the hospital on every protocol. And that has been shown to cause, renal failure and other organ failure. And that was based on a study where 50% of the people in the study died. But the NIH thought that was the medication that should be on all the hospital protocols. So, I mean, it really blows your mind when you start to think about the way that these protocols were created based on very poor research of the medications that they chose to use and the drugs that were actually saving people. Then you started to see all these articles come out about how dangerous these drugs that had been used for decades, that have a very minor adverse effect profile, how these drugs were killing people. So then none of the mainstream, hospitals and clinics, none of those providers could prescribe it. And even my sister lives in Rapid City, South Dakota, and I am licensed in South Dakota, so I can see people there as well. But her husband works in the hospital, and they have put up flyers on how dangerous one of the main life-saving drugs are. They have signs all over the hospital telling people to not prescribe it and not to use it because it's so dangerous. Even though this particular drug...
In a hospital.
In a hospital. Yep. Even though this drug has been used over 4 billion times, it's just, and has such, it's safer probably than Tylenol. But they have signs all over the hospital just to warn people not to take it.
But the one that is actually hurting people,
yep,
they're prescribing. They're using as a general course of treatment.
General course, and they get money if they use the protocol. The hospitals get money if they do what the CDC and the NIH tell them to do.
That's because you're a right-wing fringe lunatic who believes in conspiracy theories and probably don't have a real medical or a doctorate. You're just making it all up.